Hi everyone, thank you so much for coming today. My name is Hannah Cho and my presentation is called Meditation's Physiological Effects on the Nervous Systems of Teachers Undergoing Stress. Some things about me are that I'm a rising senior at North Hollywood High School in Southern California, and I'm interested in pursuing neuroscience and cognitive science in college. I am a student researcher at the Brain and Creativity Institute at USC. I've been doing it for a year, and currently I'm working on an investigation with analyzing fMRI scans. I also volunteer as a crisis counselor for the California Coalition for Youth Crisis Hotline, and my passion is to synthesize neuroscience, computer science, and public health all together. All right, so to give some background about what my study is on, stress, according to the American Psychological Association, is one of the 5 leading causes of deaths. It also takes 5 million lives yearly. As you can see in this survey taken from before the pandemic and at the height of the pandemic, there was a 30% increase of adults reporting symptoms of stress. On top of that, 75% of teachers normally report job-related stress. So as one could assume, during the pandemic, teachers have been especially susceptible to pandemic-induced stress. And meditation has long been known as a valid form of therapy to reduce stress. The 2 types of meditation I focused on in my study are visual and focus. Visual being imagining doing or being something, and focus being something like counting breaths or beads on a string. So what is the autonomic nervous system and what does it have to do with stress? The autonomic nervous system is just one section of our entire nervous system, and it is in charge of controlling our involuntary responses. Therefore, we can see how stress affects involuntarily through the nervous system. ANS, there are 2 subsections. One is called the SNS or sympathetic, and the other side is called PNS or parasympathetic. The SNS is commonly known as fight or flight, and PNS is commonly known as rest and digest. And true to name, they do control functions related to those, such as increased heart rate, blood pressure, and sweat, and PNS does the exact opposite. I found how the nervous system is innervated through heart rate variability calculations. And what heart rate variability is how much the time in between each heartbeat fluctuates. So I'll be calling this time RR and IBI from now on. And depending on how fast the heart rate is, the HRV value changes. For example, if you have a fast heart rate, that means the time in between each beat is smaller, meaning you have a lower HRV and therefore more stress. And I measured this HRV with numerous indicators. So in this case, there's 3 for each side of the system. And the point care plot, to give you some background information, you plot all the RR intervals together on a scatter plot, which assumes the shape of an ellipse. The lengths of the ellipse are then called SD1 and SD2, and I'll be discussing that later in my conclusion. And we basically use these 3 indicators to average out an index value. For example, you can see in this picture, the index value is 1.94. This means that this person is 1.94 standard deviations above the average population. So you can assume that this person has a higher recovery index than average in this situation. So how I went about collecting my data was I got 8 teacher participants to join a Zoom from January to May of 2021 and wear wristbands that collected the IBA data. Then a licensed therapist on the Zooms would conduct either visual or meditation each month. And then afterwards, there'd be an engagement period where they talked about the stress in their lives. The data you can see here was exported to Cubios, which is the analysis platform I used. Then I choose one section from meditation, one section from engagement, and then compare the 2. This is like a raw data snippet where this is the duration of time and these are the IBA values. I then proceeded to correct artifacts. What artifacts are they are abnormal data values that do not represent the physiological change I'm trying to see in my study. For example, someone could have moved suddenly here and that could have invoked this change. Therefore, these 2 abnormal peaks, I corrected with an interpolated beat algorithm from Cubios, and you can see that the beats kind of even out. So from my results, I saw that in visualization meditation, 1 month, which was January, where participants pretended to be a tree, most of the participants exhibited a lower PNS and a higher SNS during meditation than during engagement. Basically, this means they had less calm and action. In April, participants pretended that they were doing things in their body, such as zooming through the bloodstream or inside the mouth. What this invoked was a higher PNS and a mixed SNS, which means that it was half and half between participants. Focused meditation had a more common trend, with both months showing a lower SNS and a higher PNS during meditation. This means less stress and more calm. As for my results, I saw that in six out of the 8 participants for the indicators showed that heart rate was lower during meditation. The mean RR was also greater during meditation, showing that they have an inverse relationship between the two. There was also a greater ST2 value during meditation for 5 out of the 8 participants. And 64% of the total data sets had a higher PNS during meditation, which means that they had more calm activation during meditation. It aligns with the previous study done in 2018. So to conclude, I saw that the SNS indexes were mostly positive and PNS indexes were mostly negative all of the time. This could be due to the idea that teachers are more stressed than the average population, which I showed in my introduction. It could also be due to the idea that this was a social situation, so people would not have like 0 values for their indexes. And this could also be due to gender, because according to the API, women are statistically more stressed than males. And as most of my participants were female, these two facts could have a positive correlation. And another big idea I saw was that the percent of change of indexes were different for every participant. So the amount of change seen from meditation to engagement was different for every person, which shows the idea that and visualization meditation has some conflicting ideas, and I think these could be due to a variety of covariates, such as relatability, comfort, personality, age, and gender. For example, an extrovert could feel more comfortable in the engagement section rather than the meditation section. And January was more stressful, maybe because people had a harder time being engaged with the idea of pretending to be a tree rather than something that they're comfortable with, such as their body. And as for focus meditation, I was able to conclude that focus meditation is very valid and consistent in reducing stress and promoting recovery. On the other hand, I would not recommend visualization meditation yet because it is very volatile and personal to each person. And for the indicators, a lower heart rate during meditation shows that meditation was less strenuous than engagement. A higher ST2 during meditation also indicates a higher long-term HRV. A long-term HRV means long-term health benefits. So indeed, meditation have long-term health benefits for the heart. In the future, I'd like to conduct a baseline measurement so I have a middle point to go off of, as well as cross-analyze other functions of the body that the SNS and PNS are responsible for, so I can get a big picture of how the body reacts. I'd also investigate the covariates to see how much an effect they truly do have on our results. These are my references, and I'd like to thank the USC Center for Effective Neuroscience Development and Learning and Education for the data and assistance. And thank you to the audience for following along. Please contact me at this email if you have any inquiries. I'd love to see what you guys want to talk about. Thank you.